for chlamydia infection, doxycycline versus azithromycin. My name is Diana Kawa, and Facebook Dayanara. University Catholic of Santiago of Guayaquil, Nursing School. Definition: is a sexually transmitted disease caused by common bacteria. You can get chlamydia during oral, vaginal, or anal sex with an infected person. But men and women can have it.
I'm Dr. Peter Graver from Rensselaer Beach Family Medicine in Wilmington, North Carolina. I want to talk a little bit today about chlamydia infections. Chlamydia is the most common bacterial sexually transmitted disease in the United States. Hundreds of thousands of people are diagnosed every year with chlamydia. The interesting part about chlamydia is that most people don't have any symptoms of chlamydia. It's found when we're testing for other things or as a routine screening. So if you don't have symptoms, you can't necessarily be sure that you don't have it. It's important to get regular checkups with your healthcare provider to make sure. Also, prevention is crucial in not getting chlamydia, because if you don't have symptoms, you don't know if you're transmitting it to somebody. Men and women can have chlamydia infections. Men can be carriers and transmit to women. Women can be carriers and transmit to men. And of course, if neither of them have symptoms, it's hard to know which person would give it to whom. So wearing condoms is very important, and getting tested regularly is very important. The chlamydia is relatively easily treated once you get it with just a short course of antibiotics. But if you don't treat chlamydia, you can have problems with childbearing later in years, as the infection scars the fallopian tubes, or the tubes that lead the eggs down into the uterus for implantation. So it's real important to get it treated. And if you have any signs or symptoms, men might have a little drip or an itch from their penis. Women might have no symptoms at all, or maybe a vaginal discharge. Please seek information from your healthcare provider and physician about what to do. That's a little bit about chlamydia infections.
Application in nursing. Chlamydia can be early, treated, and cured with antibiotics. Treatments are most often using a single dose of azithromycin or with of doxycycline twice daily.
This bacteria after antibiotic treatment in a healthcare facility, but may be delayed up to 6 or more weeks after discharge. Other risk factors for CDED include advanced age, immunocompromised state, prolonged, current, or recent care in a healthcare facility, cancer therapy, abdominal conditions such as Crohn's disease or surgery, and previous infection with C. difficile. Gastric acid suppressants such as proton pump inhibitors may also increase the risk of CDED. Most patients will acquire C. diff as the result of recent hospitalization. However, there have been reports of community-onset CDED in previously healthy people with little or no exposure to a healthcare setting. That's why CDED should be suspected in anyone with severe diarrhea, even if they don't have traditional risk factors. Also, it's important to note that up to 30% of patients treated for C. diff colitis may have a recurrence, typically within 2 months. What can be done to prevent and control C. diff in the healthcare facility? Because C. diff is easily transmitted and is difficult to remove from the environment, infection prevention and control measures are critical. Standard precautions should be practiced for all patient care in all healthcare settings. Not all patients who carry C. diff show symptoms, so hand hygiene must be practiced before and after all patient contact and patient room encounters. Personal protective equipment should be used when there is the likelihood of contact with a potentially infectious material. This may include the use of gowns, masks, and eye protection if there is the risk of splashing or spraying of any body substance. And there should be very careful attention given to the cleaning and disinfection of the patient care environment and patient care equipment. In addition to standard precautions, the CDC recommends placing all patients who have or are suspected of having CDED under contact precautions. All contact precaution rooms have signs to warn healthcare workers that extra infection control measures
Pros and cons. Latex condom in men, when used consistently and corrected, can reduce the risk of transmission of chlamydia. Having multiple infections increases the risk that women have serious complications that affect their production health.
Chlamydia infection is a common sexually transmitted infection in humans caused by the bacterium Chlamydia trachomatis. The term chlamydia infection can also refer to infection caused by any species belonging to the bacterial family Chlamydiaceae. C. trachomatis is found only in humans. Chlamydia is a major infectious cause of human genital and eye disease. Chlamydia infection is one of the most common sexually transmitted infections worldwide. It is estimated that about 1 million individuals in the United States are infected with chlamydia. C. trachomatis is naturally found living only inside human cells. Chlamydia can be transmitted during vaginal, anal, or oral sex, and can be passed from an infected mother to her baby during childbirth. Between half and 3/4 of all women who have a chlamydial infection of the cervix have an inflamed cervix without symptoms and may not realize they are infected. In men, infection by C. trachomatis can lead to inflammation of the penile urethra, causing a white discharge from the penis with or without a burning sensation during urination. Occasionally, the condition spreads to the upper genital tract in women, or to the epididymis in men. Chlamydia infection can be effectively cured with antibiotics. If left untreated, chlamydial infections can cause serious reproductive and other health problems, with both short-term and long-term consequences. Research is ongoing in the prevention of this infection. Chlamydia conjunctivitis or trachoma is a common cause of blindness worldwide. The World Health Organization estimates that it accounted for 15% of blindness cases in 1995, but only 3.6% in 2002.
In Ecuador, but in Ecuador and in the other countries there was an increase in the extramarital among teenager sex with high percent of those who have sexual intercourse before age 18 years, and being the media reported in our studies 16 to 18 years in 62.2% of those who had already lived this experience.
Busy Boxes, expert information on chlamydia. What is chlamydia?
Chlamydia is a bacterial infection that is sexually transmitted. It occurs very commonly in the UK, and chlamydia is probably the most commonly diagnosed STD, sexually transmitted disease, that we have at the moment.
How do I get chlamydia?
Chlamydia is passed on from person to person by sexual contact. So very many people think that chlamydia is only passed on by penetrative sex, so anal or vaginal sex. But in fact, chlamydia can be passed on by mouth to genital contact as well.
How common is chlamydia?
Chlamydia is one of the fastest growing STDs in the UK, and around about 100,000 plus new cases are diagnosed each year. Chlamydia is particularly common amongst the very young populations between the ages of 16 and 24.
Does chlamydia affect men and women?
Chlamydia will affect anybody. Anybody who has sex. The difficulty with chlamydia often is that it can be a silent infection, so chlamydia need not necessarily cause you to have symptoms, and so you may pass it on easily.
How do I know if I have chlamydia?
You often don't know that you have chlamydia, and the only way to be sure that you don't have it is to have modern tests for chlamydia. So certainly if you're changing sexual partners very often, then you should be tested for chlamydia on a regular basis.
What are the symptoms of chlamydia?
Chlamydia may have some particularly diagnostic symptoms, such as pain when you pass urine, occasionally discharge. Certainly for females, then it may cause what's called pelvic inflammatory disease, and that tends to cause a generalized lower abdominal symptom.
How can I protect myself from chlamydia?
People can protect themselves against chlamydia by using condoms, and also by getting screened after casual sex.
How do you test for chlamydia?
Testing for chlamydia is very, very easy. So in the old days, when I was a student, we used to go along to the clinic and they'd shove an umbrella down your penis. We don't do that anymore. We just ask people to save some urine.
How long does it take to treat chlamydia?
Treatment time for chlamydia from beginning to end, before you can resume sex again safely, is maybe 48 hours to 7 days, depending on the treatment.
www.busybox.com.
Conclusion. The surrogate was to help about transmission of the